who go above and beyond to carry out your duties, for keeping us healthy, for keeping us safe. Because of you, we are hopeful for the future. Because of you, there is light at the end of the tunnel. We don't have enough words to express our gratitude for your sacrifices. We can only acknowledge it and say thank you. National Health Mission, Government of Meghalaya.
Good evening, everybody. The National Health Mission is back in its efforts to continue the conversations around COVID-19, because whereas everywhere else it appears that the disease has been mitigating, but in Meghalaya, we have two things that are happening. One is we have still a very high positivity rate of about 8 to 10%. And secondly, the vaccination count is very low. We still have been vaccinating only 16 to 17% of our population, and that is not a good thing. So to help us increase the vaccinations and decrease the fear that surrounds this disease, because people are still not coming up and getting tested. People are not coming into the hospitals to get treated. People are confused about what to do with the comorbidities. People are scared as to whether they should get vaccinated or not. We have gotten together a panel of doctors who are going to talk about these things so that all our viewers and even the doctors who are listening will have their doubts cleared, and we can go forward and move together so that we will be able to enjoy our lives again. Lada pibaro khot pikwa baka jing im jungi kan long biang kumba menshua maginum don kaman ri hayen tipide ban snap ha yakabakini ki doktor ki ong knang ba ngindup la ban penlep yakane ka jingpam. We have two doctors with us, Dr. Flora Marak, who is the medical specialist in Ganesh Das, and we have Dr. Tariang, who is also a medical specialist with the Government of India. They are going to tell us what is the local scenario and how they are facing problems which can be sorted out by the person who we have tonight with us, Dr. Ambrish Mithal, who is so good at what he does and has so much experience in the treatment of this disease, and especially because he is the person who handles our point of interest today, which surrounds comorbidities. Dr. Ambrish Mithal is an alumni of KGMC Lucknow and has been awarded Padma Bhushan by the Government of India. He is presently serving as the chairman of endocrinology in the Max group of hospitals, and we are so lucky to have him with us. Thank you, Dr. Mithal. I know, and we all know how busy you are. You are chock-a-block full, and we are so grateful that you are here with us today to help clear up our doubts and to talk to the doctors as well as the people of Meghalaya so that we are able to move forward. Dr. Mithal, thank you for being with us. I hand over the podium to you.
Thank you very much, Carreen. Thank you very much, Dr. Pakrasi, the other doctors, for inviting me here. It's indeed a pleasure to be with all of you, and if I can be of any little help, or if my inputs can help even like 1%, 2% in combating this deadly virus, I think it'll be worthwhile. It's really an honor that you chose me for this. And as I was telling Dr. Pakrasi, that the last travel I did before this ghastly virus struck us was in February of 2020. and that was to your beautiful city of Shillong. And it was a one-day trip as usual, and Dr. Pakrasi is well aware of those. But the fact is that it was enlightening, and I really wanted to go back, but then maybe once all this is over. Thank you very much for having me. I'll be happy to participate in this.
So, Dr. Mithal, if you could start off by, addressing some of the issues which surround COVID in general as regards diabetes and other endocrinology diseases. And, there are a lot of people who somehow it seems that this the fact that we are going out, in the state itself, they are very good at isolating cases and not finding cases. And, but it seems to be having a double-edged sword. People feel that if they have diabetes, if they have any comorbidities, then, they should not go out and vaccinate themselves. And they feel that, oh, no, we shouldn't tell people when we get sick, or if we are, they don't even get tested sometimes because they feel they'll get whisked away by the government and they'll get isolated and they'll get separated from their families. So if you could just tell them a little bit, why is it important for people to come forward, get tested, see that they have the disease, know that they have it, and control their comorbidity conditions?
So I think the important part, we faced this a lot last year in the first wave, facing a little less this year, because people were concerned that if they announce that they are positive, then they will be, as you said, forced to isolate themselves from their near and dear ones and, stay in a separate area. Or initially it was even hospitalization for all positive cases, but then that quickly changed when the numbers increased. So I think COVID is not a stigma. Most of the time, it's not your fault you got COVID. It's a bad virus that is circulating, coronavirus. And sometimes, despite best precautions, we may catch it. Although it is true that if you're really careful, and we'll discuss what that care is, then you can protect yourself to a large extent from catching the bug. However, if there is any suspicion, it makes no sense to hide it. You absolutely must get your test done, because you could be landing up in serious complications and then unnecessarily have to, you might expose yourself to more serious conditions in the sense that your lungs could get damaged and so many things could happen and you don't realize it and you're just thinking it's sort of a mild fever. But that's one part. Very few of you will go on that track. So 85% of you will not go on that track. 85% of people who get COVID infections don't go on that track. But that is one, at least you should be aware. But I think even more important is the fact that you can spread the disease to others. How do you ultimately get rid of this virus or this pandemic is by not allowing it to spread. And unless if you know that you have COVID and you have to isolate yourself for X number of days, follow the protocols, you will go on spreading. And even if you escape the seriousness of the disease, somebody else in your family, someone very close to you, especially older patients, older family members, can actually catch the virus very quickly. So it is important that disruptive kind of mechanism as compared to other diseases. This is kind of disruptive. So you suddenly land up with, the main thing is being isolated from your family members. But I think that we have. So I would strongly encourage people to get tested, confirm the diagnosis, and follow COVID protocols.
Dr. Mithal, one thing I'm hearing from the doctors over there is that last time people were more scared. the lockdown was more strict, and not a lot of people got sick. So they feel, oh, we did all that and nothing happened to any of us. But I don't think that we can stress this enough. There is a difference between the old variant and this variant. So could you tell people, that why is it that they still have to be scared? It doesn't mean that we didn't get sick last time, so we won't get sick this time,
That's certainly not true, that if we didn't get sick last time, we won't get sick this time. The second wave of the COVID-19, of the coronavirus, was driven by the Delta variant. There is no doubt that the Delta variant is more infectious than others. So it spreads much more rapidly. And therefore, and we've seen that in Delhi, and Dr. Pakrasi is here, we've seen that in Delhi, how rapidly it spread. Family after family, 15 people, 16 people, 11 people, everyone got infected. Last year, 2020, the spread that we had was not so widespread. It was still curtailed, still manageable. Look at the number of cases that are being reported. For example, we were reporting 4 to 5 times, in fact, 5 times more cases this year. And even if you believe the numbers on face value, still they were about 5 times of last. This variant is highly infectious. It may or may not be more lethal, but the sheer numbers are so many that there is no way that we can take last year's example. We could learn from that, and I will tell you what has changed between last year and this year. But quite clearly, this Delta variant, which caused this outbreak, at least in Delhi and Bombay and other major cities, is definitely more infectious. And last time, if one person got it, the other person in the family escaped, something else happened. This time, it's everyone. When we say variant, what do we mean? We mean that all viruses tend to mutate, which means they are fighting for survival. So they keep coming back after mutation. Sometimes the mutations lead them to reduced virulence, sometimes enhanced virulence, but in general, they tend to increase the transmissibility. So the virus mutated, and there's so many mutations, hundreds of them, but only a few are mutations of concern or the viruses being variants of concern. So this Delta virus is definitely one of those. We had one that was first found in South Africa, one in Brazil, one in UK, and it's the UK variant that actually started the first wave here. But then it was rapidly overcome by the Delta virus. So I think we need to be aware that if last year we got away scot-free, I'm sorry, it doesn't ensure that it will be the same this year.
So I just tell our viewers that we are on Facebook Live and we are on YouTube, and you can either email your questions or you can just go on Facebook and type it. There's somebody attending those channels all the time. We want you to talk to Dr. Mithal because this is the whole idea of having this session. You need to learn about the disease. Only if you learn about the disease will you stop being scared of it. Only if we are less scared of this disease will we know what to do. And if we know what to do, then together we will be able to overcome it. So, Dr. Mithal, I just wanted to, pick your brain. I don't know why do you think that everywhere else the positivity rate has gone down, but in Meghalaya the positivity rate seems to be hovering around 8, 10, 11%? Is it because we are only testing those people who are sick? Is it because we are reporting? What do you think?
Well, there could be multiple reasons, but it's also true that the way the wave hit Delhi, and you are here yourself, it had to go down like that because it infected almost everybody in its path. And if the rise is slower, the decline will also be slower. So I as far as I am aware, I don't think Meghalaya got hit in the way that some of the cities like Delhi and parts of UP and other parts, MP, they've gotten hit. So when the virus comes on suddenly in a burst and infects lots of people, then it also goes off suddenly. Whereas here, probably what's happening, progressing slowly, not at that same steepness of curve, and therefore it will probably go off slowly also, which actually gives you a chance to implement preventive measures and prevent the spread.
I guess we should be grateful for this opportunity that we have, to prepare ourselves and to respond better. But I think we will bring Dr. Flora Marak and after that Dr. Tariang, so that, they can directly tell you what their experiences have been on the ground. So Dr. Flora, welcome to the program, and please you feel free to talk to Dr. Mithal and ask him anything you like.
Thank you, Dr. Pakrasi, for this time. And let me tell you, an absolute honor it is to be sharing a screen with such a noted person. Thank you so much for this time, and I hope I will not take much of your time. The experiences we've had in our field, in my time working in the field, people are still hesitant to come forward. Like you said, so it's very true that they're still hesitant to come forward and test themselves. They fear stigma. They fear, if I get tested positive, I will be sent away, and I will not be able to see my family. And what if I die in that situation? What if I don't see them anymore? So it's true that they are scared of the disease, and then they're equally scared of staying away from their families. So that is what's keeping them. It's like a seesaw situation. So like at one point they want to be with their family, and at the other point they're like, if I test positive, if I go and check myself? So I think that is also contributing to a lot of hesitancy in terms of testing as well as vaccination. And there are lots of rumors surrounding these vaccinations regarding certain things like it is causing infertility among women. It's not good for pregnant ladies. It is not good for elderly people or those with comorbidities. So those people are coming late, and when they come late to us with that infection, it is difficult to bring them out of it. So we've been trying our level best, sir, to encourage them to come forward. We're having extensive IECs, we're having extensive programs on this. But somehow or the other, something seems to be hindering these people to come forward and express themselves or get themselves vaccinated or get themselves tested. So I hope through these programs and through such dignitaries as yourselves, so we are able to reach to this population and give them some sort of hope that working together in any way possible, we will be able to overcome this pandemic and come to somewhat near normalcy. So that's all we can do.
Do you have any questions for Dr.?
Yes, sir. I'll take this time to ask a few questions regarding thyroid disorders, sir, especially since I'm working in a maternity hospital. The concerns are more relating to the pregnant ladies, of course, in general as well. So I would like to ask you, sir, how does this infection and the disease thereafter affect people with underlying thyroid disorders in general, as well as in pregnant ladies, and the importance of vaccination in such people, sir? I would really like you to clear on that, sir.
So I think, Dr. Marak, you've raised several very important points, and I'll address them one by one. One is about vaccination. The first is that what is the way to get rid of this pandemic? It is to follow COVID appropriate behavior. Again, we'll probably come back to that, which means masking and physical distancing. But equally important to get vaccinated. As much of the population gets vaccinated, the better, the larger the population that's vaccinated, the better it is for us. And if you want to kill the pandemic, then you have to actually vaccinate very, very large numbers of the population. So that is number one. So vaccination is a tool to protect ourselves, and we absolutely have to use that. And it's not being smart if we are not. There are natural fears about any new vaccine, any new intervention, which is given to normal people, because they're otherwise normal. They're taking a vaccination. So the risks of vaccination are very low, very low. And except the fever, a little bit of body ache, arm soreness, etc., that you may get, the risks of actual serious disorders happening after vaccination are minuscule. The vaccination is meant for people with comorbidities. So if people with diabetes and people who are elderly and who have comorbidities, who are the prime sort of target in the sense that they are the most susceptible to complications of COVID, If that group does not get vaccinated, the whole purpose is lost. So in fact, the high priority groups for vaccination, as you saw the government program, is for those above 60. Now, those above 60 are the patients where the bulk of people, where the bulk of comorbidities are clustered. Therefore, vaccination for those with diabetes, blood pressure, heart disease, kidney disease, even cancer is absolutely recommended. No question about that. The very, very rare cases of blood clots that have been reported after some vaccines are exceedingly rare, and really, unless someone has a clotting disorder, you need not worry about it at all. When you pop a pill, when you pop an aspirin for headache, you can get a fatal bleeding. You know that. When you take the most innocuous pill, an antihistamine, you can get a bad reaction. So that chance of a reaction is always there. Don't sort of stay away from vaccination for those very, very rare situations. Please get vaccinated. Thyroid disorders are very common. People with thyroid disorders have absolutely no greater risk of either COVID or of any vaccination side effects. So thyroid disorders are because it's autoimmune. Some people worry, I've got an autoimmune thyroid disorder, etc. Nothing like that. A thyroid disorder will not make you more prone to COVID. It's not one of those comorbidities that makes you more prone to COVID, nor is it one of those that makes you more likely to get a vaccine reaction. So please, unless you have had a reaction to any childhood vaccine, or you have an acute allergy history where you got acute allergy like anaphylaxis with some particular food, in which case you should tell the vaccinator. Otherwise, there is no reason not to take the vaccine. So this is incredibly, if we don't take vaccines now, we are really inviting the virus to stay amongst us. The more it stays, the more it mutates, the more dangerous it becomes. So vaccine hesitancy has to go out, and in a place as evolved and as educated as Meghalaya, they should actually be leaders in this. And you should lead the country in defying vaccine hesitancy and get vaccinated, get very high proportion of the population vaccinated. I think this is very, very important. The thing about whether people should announce it or not, yes, I think it's again important. I'll emphasize the point again. Most of you will recover uneventfully after COVID. So for most of you, it's just a caution, and the fact that at least you're not going to spread the virus if you're isolated properly. There's no magic medication for either preventing COVID or preventing the spread. It's basically physical isolation. So it's not a stigma at all. There's nothing about it as stigma. I mean, that way, all of Delhi is stigmatized. I think Dr. Carreen will agree that almost everyone we know got some form of COVID or the other, even sometimes, in very strange situations, and you couldn't figure out why and how, but it happened. So therefore, it's not a stigma at all. You must get yourself tested at the slightest symptom, report to your doctor, and vaccination is 100% that's in fact the only way we vaccinate out this virus. That's the only way. And pregnancy also now has been approved. Pregnant women now can get vaccinated. It always was there, but government was obviously, because there are not enough trials in pregnancy, there is no real concern about safety. So you can go ahead with that, no problem.
Thank you so much, Dr. Mithal. I'm sorry to interrupt you, Dr. Flora. I really appreciate what you said, and I think this should be the thing that should ring out amongst all the people, that in a state like Meghalaya, where everybody is so educated, why are we being hesitant about taking the vaccine? I can't understand it. So let's say it again and again and again. We have to be the leaders. We have to show people that we are educated enough to know that the vaccine is going to protect us. Kumba iong Dr. Mithal, lada pishim ya ganega vaccine, nila ban yang lang ban penlem ya ganega jingpang, lada pikwa ban let biang shapar ban le ya ki football, ban basketball, ban long festival, ban long ban yacht sodong pide ban vaccinate yala day. Lada 70% jongka population at least ladangi la ban vaccinate lang in yang. Divided we fall and united we stand. Let us unite in going out and getting ourselves vaccinated. This is our responsibility. So just in case you have forgotten what the steps are, here are just a few reminders for you about how you can prevent yourself from getting the disease.
Do you know the COVID-19 disease can be stopped by you and me? Together, we can do this. Avoid touching your eyes, nose, and mouth as much as possible. Wash your hands with soap more frequently. Maintain social distancing and keep a distance of at least 6 feet apart. Most importantly, wear double mask at all times. One surgical mask and a cloth mask on top. If you have symptoms like cough, fever, diarrhea, fatigue, shortness of breath, or loss of taste and smell, contact your nearest health center immediately, or you can call the toll-free number 14410 for any assistance.
Issued in public interest by National Health Mission, Government of Meghalaya.
So you heard what she said. Let's fight this disease together. Again, I'm going to call on Dr. Mithal to just give us, like a few pointers. Dr. Mithal, some people ask, okay, I can't get Covishield. Should I take Covaxin? Does it really matter? People are worried that, okay, this vaccine is better, that vaccine is better. Do you think that it really matters? And as long as you get vaccinated, does the kind of vaccine that you take matter? Because, travel restrictions, this, that.
So I think that's a very, very relevant question, Carreen. And basically, we are looking at the fact that actually India is fortunate because many developing countries have no access to vaccine or very limited. We are always comparing ourselves with the more developed countries, which is correct actually, because that's how you move up. And we say that, they vaccinated so many, they vaccinated so many. But the fact is that we are blessed because we have access to vaccines more than others. It's still not sufficient, but it's much more than many other countries. So that's number one. Number two, these vaccines have all been developed at breakneck speed, literally. Never in the history of mankind have vaccines been developed so fast. So which one vaccine is superior to the other will take many years to figure out. That is not important for us. Why is it not important? Every vaccine that is in use, and in India, Covishield and Covaxin and now Sputnik, and I'm sure you'll have others, maybe Moderna very soon, they are all effective against some aspects of the disease. What is that? All the vaccines in use reduce the risks of hospitalization drastically by 90-95%. They reduce the risk of serious disease, again in those numbers, and they reduce the risk of death very substantially. So all these vaccines reduce the risk of serious disease very, very substantially. Now, on the other hand, some people may argue that the vaccine effectiveness or efficacy is 63% for one, 77% for the other, etc., etc. That is judged by symptomatic infections, which means that supposing I've got the vaccine, as compared to someone who doesn't have the vaccine, what are my chances of getting a cough, cold, fever kind of symptom? So while the efficacy in that may vary, some vaccine may reduce that risk by 77%, some by 68%, some by 80%. But the efficacy of these vaccines in preventing death, preventing serious disease, is about the same. At the moment, that's what the data indicates. So as I said, we are lucky to have access to various vaccines, whichever one is lined up for you, whichever one is accessible for you, just go ahead. Do not worry about Covaxin versus Covishield versus this. Now, there are travel issues, as Carreen mentioned. That, of course, is an issue. You'll have to see that. We are hoping that Covaxin also gets approval. We are also hoping that the Covishield and the AstraZeneca thing is sorted out, and most of EU approves that. I think that will, in the due course of time, be sorted out. But for disease prevention, and especially for prevention of serious disease and death, it is very important you take whichever vaccine is available to you without any hesitation.
So another thing, Dr. Mithal, that we are facing is this constant conversation about the third wave. So there is this thing about how you can avoid the third wave if you vaccinate enough people. So this is a very important conversation for us to have, because this is another reason why we need to get vaccinated. Because the more people get vaccinated, the better we'll be able to, the better chances we have of avoiding a third wave. What do you have to say about that?
Absolutely, I agree 100%. Because what is the purpose of vaccination? The purpose of vaccination is not treatment. It is preventing the spread of disease and preventing serious disease. If we develop immunity to the virus, even if it's partial, even if it's a new variant, when you are vaccinated, in the gap between two waves is the time to fill the population up with vaccination. Just jab everybody. If you can do that, you're really protecting yourself from the third wave. I think that is very important. The problem that happened in India, why it all went topsy-turvy, was also, in addition to whatever else might have been the reason, there were two reasons why it went completely crazy in India, especially in the larger cities and all, in the months of April, particularly April and May. And the reason was, firstly, that there was this variant that came in, right? That, of course, I already said was very infectious and spread fast. But also it happened simultaneously as we were increasing our vaccination. That's quite crazy. I don't think in the history of mankind, humankind, if you say, we've had a situation where you're vaccinating when the disease is surging. You vaccinate in between to prevent infection. So that's why the whole vaccine thing became very confusing, because people got a shot, they were already infected, they got a shot, before protection could kick in, they got an infection. So it was quite terrible. So that's why if our vaccinations were 2 months earlier, or the wave started 2 months later, we would have been much better off. But it happened, unfortunately, simultaneously. February started picking up, February when our vaccinations started picking up. So now we have that chance. Now there is no excuse. Now we have this window where we don't know when the third wave is coming. No one knows. Everyone is speculating. I can also speculate, but it's speculation. But the fact is that if we are able to jab most of our people in that period, in that gap, in that breather that we've gotten, I think we will be much, much better off. Much better off. And the third wave, even if it infects us again, will not cause deaths, will not cause ICU overcrowdings. So you may get mild infection still, but it will not be that serious. So very, very important.
Yeah, actually, that was the thing that gave, partly, I think, the scare or the fear about getting vaccinated is this, because people were going to get vaccinated, but either they were already infected or they were getting infected by other people who are carrying the virus. So people feel that, we got the vaccine and we got infected. Yeah. So if you could tell our viewers about that, and then after that, we'll get Dr. Tariang in.
So there is no way that the vaccine can cause COVID. Vaccine cannot cause COVID. So and some of our patients can correlate that we got the vaccine and 5 days later, and that is because they got infected at the vaccination center. And that's simply because at that point, the virus was spreading so rapidly. That is just a one-off. Now there's no problem in any vaccination center. Only for those 1 or 2 weeks where it went completely crazy, where we didn't know who's infected, who's not infected. So the vaccine cannot cause COVID. So please be relaxed about it. At the most, it can cause a couple of days of body aches, low-grade fever, arm pain at the injection site. Some people get headaches, some people get dizziness. but nothing. Think of it as a mild viral, small price to pay, and many people get nothing. In the same family, you vaccinate, half of them don't even know, they have nothing, and the other person has to miss work for one day. So there are things like that, but absolutely it cannot cause the COVID.
Yeah, it's so funny that, the other day at the hospital, some people were vaccinated, they didn't feel it. They said, "You've not put the vaccine for me." So that also happens. It's so mild that, people feel that they haven't got the...
Yes.
They have to feel that. So this is also another thing that we have to talk about, that if you're going to the center and getting vaccinated, obviously they're going to put the vaccine for you. That's in the interest of the people putting the vaccine to vaccinate you rather than, just pretend or something. I don't know why people even talk about this. It's quite strange. So anyway, now we'll just have Dr. Tariang in. And Dr. Tariang, Dr. Mithal is here, and you're, you are on the ground. So whatever are the problems that you're facing with diabetic patients, this is your opportunity, to pick his brain. He's in front of you.
Thank you so much, ma'am. Carreen, it is indeed a pleasure for me to be among the two of the most noted medical personality who have known. And actually, in our ground reality, actually this year we have seen so much mortality. Compared to last year, we're seeing so much mortality this year compared to other years last year. So actually, one thing is the most important is that people are fear of stigmatization. People are scared of being stigmatized, so they come a bit late to the hospital. And especially even people with comorbidities, they're coming very late. So actually, those are the people who require to come to the hospital early, but because of the fear of the stigmatization, they're coming a bit late. So I think we need to be clear with that COVID is not a stigma, as Sir has said earlier. So we should not be scared of coming forward to test in order to take care of our own family members, to take care of our friends, and so that they don't get the COVID. And I have a question for you, sir. Actually, I want to know regarding what is your take on diabetes with COVID? Whether all diabetic patients suffer severe COVID or not all of them, or any, there is difference between controlled diabetics and uncontrolled diabetics?
So I think that's a very relevant question. From the very first data that came out from China, it was evident that people with comorbidities, now even the man in the street knows the word comorbidities. No one had heard of it earlier except doctors. So people with comorbidities tend to have poorer outcomes. What does that mean? It means that these are sicker people. People who are sick have poorer outcomes with COVID. So let me give you an example. We published a study on 400 consecutive patients at the place where I work at Max, and we found that 38% were known diabetics. These are admitted patients. We're not talking OPD, hospitalized patients. 38% were known. They came, yes, I am a diabetic. 9% didn't know they were diabetic, and they were found to have very high sugar, like A1Cs of 12, 13, 11, crazy figures. So very high blood sugar, which were pre-existing, and we discovered that. Another 5-6% didn't have anything. A1Cs were normal, but simply the stress of the virus and the infection caused them to to have high blood sugar. So there are three reasons. Number one, just the simple stress of infection. Any viral infection can aggravate diabetes, or sometimes any acute illness can cause new onset hyperglycemia. It is thought that this virus may have a specific predilection for the pancreatic beta cell, and therefore it may be even further enhancing this. And very importantly, because steroids are life-saving sometimes in the second week of disease, when there is an inflammatory storm, at that point, the use of steroids can raise blood sugars a lot. So you already are battling stress, etc., and your body is really raising their sugar. But when you add steroid, the sugars go sky high. You see numbers of 400, 500. And if you're not careful about managing those sugar values at that point, your outcomes are bound to be poor. That is what COVID does to diabetes. What does diabetes do to COVID? When you have diabetes and you get COVID, the overall risk of serious disease is much higher. But I'll explain that. You cannot put all diabetes in one basket. There are sort of bands of diabetes. Someone who has well-controlled diabetes, relatively younger, and no other comorbidities, hypertension, heart disease, kidney disease, their outcomes are as good as someone without diabetes. At the other end of the spectrum, you have someone who has had diabetes for 40 years, his kidneys are affected, eyes are affected, heart has an issue. You are likely to be much more vulnerable. So diabetes is not one disease, it's a band from the left, which is very mild, well-controlled diabetes, to the very severe with multiple disorders. Two more points here. One is the fact that we didn't find diabetes alone as a predictor of outcomes. We found the presence of other conditions like a clustering with diabetes and hypertension, diabetes, hypertension, heart disease, diabetes, hypertension, kidney disease, diabetes and kidney disease. So when you have these combinations, that's what increases the seriousness. Plain diabetes often does not. So I think that is important to know that the poor outcomes are actually often linked to comorbidities that coexist along with diabetes. And also, if you are checking your blood glucose regularly, and if you keep your diabetes well controlled, and God forbid you get COVID, and at that point you are in touch with your physician, and you are able to manage your sugars well, then your outcomes are not different from anybody. So there is no reason to feel that if you are a diabetic, you're going to certainly catch COVID. No, the risk of infection is not higher in diabetes, but having caught the virus, the risk of serious disease is higher for those diabetics who are not well controlled and who have other coexisting conditions. But a well-controlled diabetic who's looking after himself or herself is managing with blood glucose regularly, checking blood pressure, making sure you're doing your little bit of exercise, eating healthy. Your risk is not very high at all. So it's very important that people call me because all my patients have diabetes, or most of them. And they'll call, oh my God, now I'm gone. Because I've got diabetes and I'm so scared. So diabetes is no reason to get scared. It's just a reason to be more vigilant. And while we're describing these things, there is one more point I'll take this opportunity to explain. What we have learned about prevention from last year versus this year. Excessive emphasis on hand washing, hand hygiene is not required. Surface transmissions are not so common. So last year we were spraying the feet every time we changed the patient. It was just too difficult. And the table and everything. So now we only wash our hands after every patient, which is in any case, avoid touching your face always. The important thing is the surface transmission is a very small proportion of our, it's the air transmission. So we need very good masking, not wearing a mask around the neck, or in Delhi, no one covers their nose. They keep the mask around the face, around the mouth, and they forget the nose. So it has to be nose and mouth and snugly fit. Like it has to be really snug. And if you do that properly, you are protecting yourself to a large degree. Not only that, if you can avoid indoor gatherings, reduce your time spent in air-conditioned environments. If the weather is good, keep the windows open. You'll be much better off. All the outbreaks have occurred in indoor environments, often air-conditioned, often where ventilation is poor, and at the same time, while we are talking about masking and distancing, ventilation is a critical point. Open air infections. If you meet your friend in the park and you're not sort of hugging each other, you're just walking along and both are wearing masks, the risk of infection is very low. In between Delhi, there was this whole thing about, it's in the air, so keep all windows closed, keep everything closed. Actually, it doesn't really spread like that. Open air infections can happen, but they're quite rare. almost all outbreaks happen indoors with poor ventilation, with poor masking, and our, closely people talking, taking off their mask to have a cup of tea, or enjoy a meal together. That's a problem. So I think we need to emphasize those points and not be obsessive. We have to wash our hands. Don't have to be obsessive about it, because last year half my time went only washing my hands. But now we know it doesn't really matter so much. You have to wash after every patient, but not like, oh, you touched this, now again you go. Now I've touched the door, again I go. So don't have to be so obsessive.
Oh, thank you so much, Doctor. I think that is a really, really important message. And I will ask Dr. Flora to actually say that in Garo for our Garo viewers. And I'm going to say it once in Khasi again. Piha ban pong mask. Kamar kaditang ka mask kabala ban protect ki. Kumbay ong Dr. Mithal. Hindi ban pong mask tak suntur. Nlasu ban yoso namar la pong mask. Hindi ka. Ka mask di ban tak ikakmut. Namar nakakmut higarong ko virus siya po. Ladap hikren kami nakasuntur, but kalidum siya kakmut yung ito diway. Ti pi pong mask nang ba apor ba pikren, ito ki virus kinumya siya ito ba pikren. Tinang tagi ito ki priyo ki ba pikren ma pi pade, ki pong ka mask nang ba nung kakmut yung pikren kalong pa. Yeah, Dr. Flora, if you can just say that in Garo once for our Garo viewers, yeah. Sorry, Dr. Mithal.
No, it's very important. That's the whole purpose. And I can see some questions in the chat box also. So whenever you want, we can.
Yes, that's right. So whenever you're ready, you can just answer those questions.
So the questions here are, how is the treatment of COVID with steroids? Maybe the sugars, we've already talked about that. Sugars with steroids, but temporary insulin therapy is often needed and quite important to battle this. And your doctors will guide you through this, not a problem. So don't be scared of insulin. If supposing you get 400, 500 sugars, when you're on steroids, doctor cannot manage with tablets. They will introduce insulin very often, so just follow that. It's temporary. Taking insulin once does not mean that it is going to be permanent. It is not addictive. And this is something that is so deeply sort of embedded in everyone's brain that it's like I have to get inside and pull it out. No. When you get an infection like this, it is temporary insulin usage, right? That's what. And that's about 10. Is this vaccine, what about long-term side effects? Very unlikely. See, no one can give you a final answer. But I think, the scientists are not fools. There can be some differences in efficacy, but randomly anything can happen. But I don't think we are worried about long-term side effects. What will happen? My guess is that over a period of time, a few of these vaccines will remain, and the rest will drop out. Once the world has access to the best 2 or 3, and we don't know which are those right now, then they will remain, and the others will probably drop out. But I don't think there's any fear of long-term side effects. But rare things can happen, and we can't rule that out. At the moment, there is no such. This is a very, very important question. This question was from Van Bok, then Renboriang, who asked about is vaccine is long term, and then Rengola. Is this current vaccine effective against the Delta variant? It is less effective against Delta variant than it was against the native COVID, wild-type COVID virus, coronavirus. But it is effective. Again, I will emphasize the efficacy in preventing deaths and admissions and serious disease is very high, almost similar to the first one. The efficacy in preventing infections is slightly lower. So you may land up with a cold and cough, but it's unlikely that you land up in the ICU if you have been properly vaccinated, which means in our vaccines, 2 doses and 2 to 3 weeks after the second dose is when you are protected. So most of the infections in Delhi happened between first and second jab. Because as I said, we just started the vaccination and boom, the wave came. So I think that's it. So there's also a question by Nantilang why there is no guarantee for this vaccine for the people. I really can't answer that. I think lots of vaccines, when the whole world is facing a vaccine shortage, except a few very rich countries. So remember that I don't think there's anything wrong in prioritizing. And definitely those with comorbidities and over 60 should be our primary target. Second should be those who who are above 45 and have comorbidities, and then the government reduced it to everyone over 18. So as and when it becomes available, I think it should be available in Meghalaya. There will be maybe from time to time some shortage, but lots of vaccines are coming in. So if the third wave gives us some time, which probably it will, then we should be able to vaccinate large proportions of our population.
The second question is actually, this question is a very important question. So Kongthe is asking that people are saying that some people died after the second dose, and she doesn't want to have the vaccine because she has, she heard that these people died, and her mother is 60 plus, and she has a heart condition. So she's like, can she take the vaccine? So I think.
I'm so glad these questions are coming up, Carreen, because this is exactly what patients ask us in the OPD all the time. So if someone died after 2 shots of vaccine, it is not because of the vaccine. It is because of the following reasons. Number one, that either there was not enough time after the second vaccine before you got the infection. So if you got it within 3 days after the second vaccination, you're not protected. So that's not really well enough. So that is one. It could also be that that person had some compromised immunity beforehand, was on some drugs that could cause, compromised immunity, like some of the doctors whom we lost and who seemed to be vaccinated properly. They had these issues even after 2 vaccinations because they had innate immunity problems or clotting problems. That's why they succumbed. But if you have taken 1 vaccine, not taking the second vaccine is not okay at all. It makes no sense. Please get your second vaccine because you're only partially protected. And especially with the variants floating around, it's very important that you complete your vaccination schedule. Please don't fear the second shot. The second shot, if people did succumb after that, it's not because of the vaccine. It's because you didn't get, the body was not able to protect itself despite the vaccine for some reason. Either the vaccine didn't get enough time or there was underlying immune disorder. So please go ahead and get your second vaccine. And for your mother, it's a no-brainer. She's a prime candidate for the vaccine. She must get the vaccine. 60 years mother, heart disease, absolutely get the vaccine.
So I think there's some viewers who want to, ask you some questions. So can we have the questions online, Prakash?
Yeah, a great question, which again I've answered today on the phone 3 times since the morning on a Sunday. Now, should I get vaccinated? When should I get vaccinated if I've had COVID? Typically, it's about 3 months. You can get vaccinated earlier. You can get vaccinated later. Why? Because there's no harm in getting vaccinated earlier. Okay? And the immunity from an infection will last typically at least 6 months. So you can even go longer. But a midway, where you're sort of, maybe you're one of those who didn't develop that good immunity, so 3 months is what the guideline is, and it's absolutely correct. 3 months after recovery, get your shot. Don't get too much into why not 4 months, why not? Just get it at 3 months. I think that's the safest. It covers both things. You get your second shot also, and also there is evidence that people who had COVID, even if they've had 1 shot, their protection becomes pretty good. So it's not a problem. But again, the same thing, 3 months is a good time to get it done after you've got COVID. Yeah, so I've already answered that SOP for vaccination of COVID contracted patient.
I have taken 1 dose of COVID. Oh.
I'm sorry. It's an unusual situation, but I think you can take your vaccine. Firstly, let me tell you, no one has done a study on this, no one will ever do a study on this. How can you do a study? But basically, it's fine. I don't think there'll be any problem. Should go ahead. So, what we are saying is, again, this is unclear, that since in first trimester, we avoid everything. Go for your vaccination after the first trimester. This is still an evolving area. Maybe after some time we'll say it's not a problem, but it'll be hard to get data on pregnant women for some time. Safety is reasonably well established, but to be doubly safe for yourself, go for vaccination after the first trimester. In first trimester, even vitamins we are careful about. So it's good to go for it after the when you enter the second trimester. So Veena wants to know, does the COVID virus cause diabetes in non-COVID people? And how can diabetics protect themselves from getting COVID? Anything more than normal COVID appropriate behavior? No, it's not a long question. Don't have to be sorry, Veena. So does the COVID virus cause diabetes? That is a subject of intense research now. It can cause a rise in blood sugar in patients, but whether that leads to actual diabetes or just a transient rise in blood sugar, that is not, a final answer is not available. Most of our patients who got high blood sugars in the first wave have come back to their baseline values now. So we don't think it is a permanent damage, but there is a theory that there might be. And globally, such cases are being collected now. So it's possible. Anything more than normal COVID appropriate behavior is what I told you, is controlling your parameters. Make sure you check your blood glucose regularly. Make sure you keep your HbA1c, which, as you know, is an average of last 3 months of control. Make sure that that is kept under 7. So I think that is those are the key things that are different from someone who doesn't have diabetes. So Jeetbon Singh, doctor, after both doses, I am protected for how long? Fantastic question. Unfortunately, I don't have a good answer, but I'll give you a practical answer, because this is just being studied right now. This is the main thing being studied. And you just read that Germany and some other countries are giving boosters at 6 months to 12 months already, considering that and preparing for October and all, so that they can give this a booster to their. In general, the period for these vaccines will turn out to be, I guess, definitely 6 months, probably up to 12 months, maybe a little longer. So I would say till the end of this year, if you've taken a vaccine, you're fine. 2022, we look at it again. By that time, we have more data. On the other hand, with some of the newer vaccines, that may prove to be a differential in the long term, like the RNA vaccines, it's very likely that they provide you protection for much longer. So we'll have to see how that goes. But if you've taken your vaccine in 2021, at least this year, don't worry about it. We'll see by that time we'll have more data. You are definitely protected for 6 months, very likely protected for the full year. By that time, we'll know if it's longer protection or not.
I think this is a very important question that has come up. So we are running out of time, and I'm going to ask Dr. Tariang and Dr. Flora to ask any more questions that they have. But we should take this actually, because this is something which a lot of people ask. Can a kidney transplant person who is still under medication get the vaccine? It's a simple yes or no question.
Yes, Sanketa must get the vaccine. When we say immunocompromised patients, it means their response to the vaccine may be not as good as someone who is not immunocompromised. Okay, so maybe his protection will not be as good as someone who is not, but the side effects are not more. So maybe you don't get 90%, maybe you get 80%. Doesn't matter. But some protection will happen. People who have had transplant, who are on immunosuppressants, must get the vaccine. In fact, they should be the first people to get the vaccine.
Kevin Sangma is talking about the clots after the vaccination. I think we already addressed that issue.
It's very rare, don't worry about it. Unless you have a clotting disorder identified. You have a rare, then you talk to your doctor. Otherwise, don't worry about it. It has been reported, but I think in the EU, out of 34 million people who got the Covishield type of vaccine, the AstraZeneca, I think they had some, it's like 32, 35 cases. So 1 in a million, or maybe a little higher than that, 1 in half a million. So it's really very, very rare. I mean, you could get a roadside accident. You could, that kind of risk, you get struck by lightning. So that kind of risk can happen. It's not worth worrying about. Not at all.
So one secret.
Sorry, there's a question about DVT patients. That's very important. You need to talk to your doctor.
That's right.
You do, yeah. You talk. If you've had DVT, you should talk to your doctor about which vaccine. Maybe you may want to go for Covaxin, but I think you should still talk to him. That's a different group. So those are patients who have a clotting problem. Then they should talk to them.
So a little secret, and that is that Dr. Mithal actually is a very keen photographer. And we are very lucky that when he had come to Shillong last time, he had taken some really good photographs. We'll go to that at the end of the program, but I think before we end, I would like to ask Dr. Tariang and Dr. Flora if they have anything more that they want to say.
So if I may ask,
Actually,
just
sir,
more for my own interest, rather. I'm sorry to interrupt you, Dr. Tariang.
problem.
Actually, it's for my own interest more. Sir, what would you say there is any relation between vitamin D deficiency or sufficiency, which affects the course of the disease and recovery? And would you say is there any association, or does it help? Since we are in the situation where all indoors, we don't have vitamin D exposure, we're all locked down. So it's more of a question of interest only, sir. So if you could just answer that. Thank you.
That's my primary area of interest is vitamin D actually, and I'm so glad you asked this. Unfortunately, the answer is not simple, but I'll just give you the gist. Because yesterday I gave a plenary on this in the IdeaCon conference in Kolkata. Virtually, of course, and it's a complex issue. But what is the practical tip? The practical tip is that vitamin D deficiency is common in Indians. It's particularly common in Northeast because of cloud cover sometimes and sunlight not being so much. Therefore, and there is no vitamin D in Indian diets. Even in the Northeast, there's very little vitamin D in the diet. So you should take a supplement because vitamin D is important for our bone and muscle. But it's also important to build our immunity. It's good to take a supplement, but don't overdose yourself. So a dose of up to 1,000 to 2,000 units a day. Well, those things you take are 60,000 units. People are popping them all the time. So 1 to 2,000 units a day will keep you protected and safe. It is likely that if you have a better D level, correct statement is that if you have vitamin D deficiency, you are more likely to catch the virus. Number one. Number two, it's not clear that if you catch the virus, will your outcome be worse? It's the reverse of diabetes. In diabetes doesn't make you more prone to catch the virus, but if you do catch it, the outcome is poor. In vitamin D, it's not clear if it makes any difference. Our own study, again, published in Nature Scientific Reports, actually suggested that if you check the D level and looked at the outcome, there was no difference, regardless of the D level. D level had no impact. But other studies have shown that in the community, if D levels are low, then your chances of getting respiratory viral infections, including COVID, are higher. So it makes sense as a community to have regular low doses of vitamin D, not stuff yourself up with vitamin D and expect that it's going to make a huge difference, but just to keep yourself healthy, to make sure that if you're testing the D level, clearly you make sure it's above 20 nanograms per hour.
Yes. Thank you so much, sir. Thank you.
Tariang, do you have anything to ask?
Actually, sir, this question was asked by one of my friends. He asked, if I am obese, am I predisposed to severe COVID?
If I have,
what is your take on that, sir?
Obese.
If I am obese,
yes.
Obesity.
Oh, yes. Yeah, we didn't. A great. I think we should end with that. But that's a really important question. Obesity definitely does increase the risk of adverse outcomes in the same manner as diabetes, sometimes even more than diabetes. Especially if it's severe obesity. Mild obesity doesn't have an impact, but severe obesity, those who are grossly overweight, BMI is over 35, definitely have poorer outcomes. And among those, even among the others, those who are overweight or obese will overall tend to have poorer outcomes in the same way as diabetes, because they also have more comorbidities. So, and breathing, and then respiratory support and chest expansion and prone, all those things that you do to manage COVID patients become harder. So obesity is a risk factor.
Dr. Mithal, I just want to thank you sincerely from the people of Meghalaya as well as from the National Health Mission. This has been so good. You have been so, precise with your answers, and I think a lot of people have learned a lot of things, including the doctors, I'm sure. And we have been so lucky that we were able to have you on the show with us. I will be showing you some pictures of Dr. Mithal's photography. Before that, I would like Dr. Flora to say something in Garo to the people of Garo Hills.
Thank you, ma'am. Ya program ko niswing pa mandirang na andak ya ching dalo na sukpa pa mungsung pa doktor ching na sukpa mang na nama advice ko akani nirang ko pati nirang ko nanjok yano ni mungsa important ba mungsung bat ka mamayong mask ko gananian anching ko ya sabisi ni ko 90 to 95% na anching ko champe rik na mana anching ko naljokat na mana ya sabisi ko manrika oni ba patrurwani ko anching saksa sakmen meng roingin chimo ba saksa sakmen meng grongger kenchino ba anching mask ko gane grongger ka onde yan ya anching ko naljokat na gata namen dakchaka aro anching saksa sakmen grongo palo balwa nama o nok kich kepawang hija balwa nama anching rona na onde aro mask ko gan go okija mas gan kuwe aro sumsa kanirang ko jakale anching grongge no de anching na ya batroroani blongin komia ar yan mungsong bat man anching ni mashirikan yara mai mas kana nang chong mota rongthal anthali ko jakale nang chong mota aro je mangan sabisi dong phag pran donga ching je khai diabetes je khai thyroid khathong ni sa ba kidney ni sa ba liver ni sa nakaba sa pran dong chapkin chung onde na simang na ya vaccine nang chungot ka pa nga na nang chungot ka ba nga aro may ba kamakinatilang niya kinatarang niya asal na song yakura chak na kiningin chimno de helpline rang no warang na kai na simang natani doubt ko clear ka naman gen aro chinguna ba question nang ko watat naman gen aro naso ni sepang ba doctor rangchi ang mangna ana simang ni kinani rang ko agani warang ko thalat naman gen uniman ekon isuing pasakan ti ko mulat paenga vaccination ko rapabo COVID appropriate behavior bajakshwani chethang ke dongani mask kanani especially double mask te ko nagana double masking aro andhana ko tika shwani ko anga mulat na skin over to you Dr. Carreen.
Thank you so much, Dr. Flora. I think now we'll have the pictures. Thank you so much, Dr. Mithal, for sharing them with us. But we are online. We'll meet you after we see the pictures.
So I got a few hours after my talk in Shillong, and I was, it was suggested. I said I want to go somewhere. That's my habit, as Carreen knows very well. So they gave me various suggestions. I said, this sounds fantastic. Let me go to the sacred forest, and it was such a unique experience, not just for the eyes, but for the soul. I really, when I go back, I want to go and spend some time there. And thank you very much for having me. And I really haven't been to Shillong except that one time. So maybe in the future. Thank you very much.
You have friends in Shillong now. You can walk at any time, Dr. Mithal. You've done us such a great service. Thank you so much from the bottom of our hearts. Thank you, Dr. Flora, and thank you, Dr. Tariang, for being with us.
Thank you,
thank you,
sir.
Thank you, Prakash and NHM team, Maria, and I want to thank Griseldis for all the work she does behind the scenes.
Do you know the COVID-19 disease can be stopped by you and me? Together, we can do this. Avoid touching your eyes, nose, and mouth as much as possible. Wash your hands with soap more frequently. Maintain social distancing and keep a distance of at least 6 feet apart. Most importantly, wear double mask at all times. One surgical mask and a cloth mask on top. If you have symptoms like cough, fever, diarrhea, fatigue, shortness of breath, or loss of taste and smell, contact your nearest health center immediately, or you can call the toll-free number 14410 for any assistance.
Issued in public interest by National Health Mission, Government of Meghalaya.
I've been working in the field of disability, specifically for children and people with visual impairment, where we try to specialize on inclusive education. I love to do my work, and that's why it keeps me going, knowing that in some way or the other, I can contribute towards the life of others and also to be an inspiration to them so that, they take life as it comes, they overcome the challenges and look for the best resources that we can live the life that we're meant to live. For that reason, with the pandemic, we were locked up in the house and it was a very frustrating time. It was simply difficult to do my work from home. When the call for vaccinations came, at the beginning, I was a bit reluctant, thinking, and with the passing of days, the lockdown continues. So I thought that in this way, I would not be able to go out and go to the office, do the work, because there's so many expectations that we have to accomplish from our funders. This is the time also when we have online teaching and learning for children. Then I decided that I needed to take the vaccination. It is a moral choice on my part. One side is for protecting myself, but the other side is more important, that I'm not the cause of the attack of the virus for others. So I got my first dose. I hear many people still very confused about this issue of taking the vaccination or not. I took the vaccination because it's my moral duty towards the society. In spite of having taken the vaccination, I wear my mask in school, at home. We have an old mother at home, so we have to be very careful. I came to the conclusion that we are all social human beings. We need to go out. We need to meet people. We need to congregate on any occasion. So that is why, if we still want to continue to live that life which we had always lived, and to be in contact with our relatives, with our friends, with our colleagues, with the world, please take the vaccination.